The recent firing of CDC Director Susan Monares and the subsequent wave of high-profile resignations have plunged the nation's leading public health agency into a state of unprecedented turmoil. Less than a month after her Senate confirmation, Dr. Monares was dismissed following apparent clashes with Health Secretary Robert F. Kennedy Jr. over vaccine policy. This action and the principled departures of other senior scientists have created a leadership vacuum and raised serious concerns about the politicization of an institution designed to be a non-partisan, science-based authority. The abrupt shake-up has been likened to getting rid of your generals in the middle of a war, threatening the agency's operational stability and its long-standing mission to protect public health. The reasons for this crisis are rooted in a clash between scientific expertise and political ideology. Dr. Monares' lawyers stated she was targeted for refusing to rubber-stamp unscientific, reckless directives and fire dedicated health experts, choosing instead to protect the public. This suggests a fundamental disagreement over the role of science in public policy. The departure of key leaders in infectious diseases, vaccine policy, and public health data further underscores this conflict. In their resignation letters, officials lamented the political pressure to act against scientific reality and warned that such actions would lead to negative health outcomes. This tension, exacerbated by a history of declining public trust, has led to a situation where the integrity of public health recommendations is now openly questioned. The consequences of this turmoil are immediate and far-reaching. The most pressing danger is a potential for a delayed or ineffective response to future health threats. With the whole chain of command disrupted, the CDC is left vulnerable to outbreaks of infectious diseases like measles or foodborne illnesses. Furthermore, the confusion over the firing and resignations, coupled with new politically driven vaccine policies, is likely to further erode public trust in health institutions. A poll from earlier this year showed that a significant portion of the public, particularly along partisan lines, was already losing trust in public health recommendations due to leadership changes. This latest event is poised to accelerate that trend, making it more difficult to encourage healthy behaviors and vaccine uptake, and potentially increasing the spread of preventable diseases. The long-term effects could be even more severe. When public health is politicized, it becomes a partisan issue rather than a shared goal. This can lead to a breakdown of communication, an increase in misinformation, and a decline in the public health workforce, as experts grow disillusioned and leave the field. Looking ahead, a restoration of trust and stability is critical, though difficult. Immediate solutions would involve appointing a new, qualified director who is respected by the scientific community and committed to protecting the agency's independence. This individual must be able to withstand political pressure and work to rebuild a culture of trust within the agency. Transparency is also paramount. The CDC must be more open about its data and the scientific evidence that underpins its recommendations. By showing its work, the agency can help the public understand the rationale behind its decisions and combat the spread of misinformation. Finally, for a long-term fix, there needs to be a broader effort to depoliticize public health. This could involve legal protections for public health officials from political coercion and a renewed bipartisan commitment to investing in a strong, independent public health infrastructure. This is a long and challenging process, but one that is essential for the nation's health and security.